welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Thank you for joining us for another episode of We Talk Health. Today, I'm joined by two of our GYN specialists and robotic experts. And today we are going to specifically talk about robotic-assisted surgery and what that means for women's health. And so I would love to introduce Dr. Don Wilson and Dr. Jeff Ball. They are here with me today. And later on the podcast, I'm going to get them to tell us how many of these procedures they have done because the numbers are staggering. But the robotic surgeries started at West Tennessee Healthcare in February of 2009. So we can truly call them experts because they have been doing these procedures for a long time and has been a big part of their practice. So today I would like to welcome Dr. Wilson and Dr. Ball to discuss robotic-assisted surgery.
Thank you, Lori. We're pleased to be here and appreciate the opportunity to discuss an aspect of our gynecology practice here at West Tennessee Medical Group G1 Specialist Clinic that we have a real passion for, and that involves a minimally invasive surgery and specifically robotic surgery in gynecology. The program at the hospital we started, or a part of starting, in February 2009, and it has really taken off in our field and into other fields, including urology, general surgery, even cardiovascular surgery. And the impetus, I think, back in 2009 was nationwide. A large portion of the hysterectomies that were done in the United States were done through an open abdominal incision, and less so through little small incisions called laparoscopic surgery or vaginal surgery. And while Dr. Wilson and I both did a fair amount of laparoscopic and vaginal surgery, as this technology kind of came to the market, we began to see the benefits of it in terms of what it might mean for our patients. And so we pursued evaluating it and began incorporating it into our practice. And as we've done so, we've really seen some significant changes. The number of open cases that we do now is less than 1% of our practice instead of...
In our clinic.
In our clinic, yes. And the emphasis on incorporating minimally invasive surgery for patients in gynecology has really caused other providers in the community as well to assess their practices and either to really work hard on their laparoscopic skills or even to embrace robotic surgery. But for us personally, we've really, I think, pushed ourselves to become better at what we were doing. We felt like we had very good surgical technique before. The device doesn't do the procedures that we offer, but it's a better tool for us. It's kind of like the difference I tell people. It's the difference between driving maybe just a basic car versus something like a Rolls Royce. You might still get from point A to point B in either one, but the manner in which you do it and the way the person riding in the car feels when they're a passenger is a different experience. And so we've just seen a real benefit for our patients from a recovery standpoint. Their pain is less, their risk of complications such as infection or bleeding, readmission to the hospital, reoperation from a complication, all those sorts of things are markedly less. And when you take that kind of holistic picture, it really drives down the cost for our patients. Most of our patients go home the same day as having their surgery, whereas oftentimes in laparoscopic or vaginal surgery, they were at least spending one night and then going home the next day.
Before you get down too far down that road, Jeff, and getting specific to surgery, I want to be completely transparent. The robotic surgery started in 2009, and I've got to brag on Dr. Ball. He was instrumental in that coming to our hospital and actually putting our robotic surgery program kind of on the map. In the early days, there were actual surgeons that would come to Jackson, and he would go to other places to teach them how to do robotic surgery. And the transparency I want to share with you is that I was one of the last surgeons at our hospital to come on board with a robotic surgery. And the reason was kind of prideful. My patients did great. I did great vaginal surgery. I did great laparoscopic surgery. I had great results, my patients did, with that. And to the point where they came to me and they said, listen, Don, you do as much surgery, if not more than anyone here. We need you to at least go look at this system. And so I did. I went to Norman, Oklahoma. And the reason they sent me there is a surgeon there had been a real well-known what we call straight stick surgeon. In other words, we called it straight stick laparoscopy. That was the old way that we did laparoscopic surgery. And so they thought, well, he may be able to encourage me to make this robotic change. It's not that I hadn't seen the great results that Jeff was getting. It's just that I thought in my practice at the time that I really didn't need that. And I remember going and spending the first day at the lab, in the robotic surgery lab, and going back to the hotel that night and calling my wife and saying, this is revolutionary, not only for me as a surgeon, but for my patients as well. And we'll talk about the specifics of that. But I didn't want to interrupt you, Jeff, but I wanted people to know that my partner here at West Tennessee GYN Specialist was on the forefront and continues to be on the forefront. And I'm just kind of second man here, so to speak, although robotic surgery has become my primary tool that I use. And Jeff is right. It is a tool. The key to any good surgical result is good surgical technique, an experienced surgeon with a good team, and we need to talk about that too eventually, is I feel our team in the robotic rooms at Jackson-Madison County General Hospital are second to none. And you may want to talk about that. When we would go to other hospitals to teach doctors how to do this surgery, Jeff would come back to me and say, man, our team is great. So excuse me for interrupting you were, but
this is a team effort. This is what it's all about.
That's right.
So, yeah, Don's really right. The folks, the nurses and the surgery assistants that help us have kind of taken on the excitement of a new technology and implementing it into their job and taking pride in what they're doing. And, we really try to work, you really as a surgeon, you cannot be a good surgeon without good help. You just cannot be. You have to have people that help you, whether it's with visualization, whether it's with equipment, whether it's with retraction, whatever it may be. It's really important. And from the anesthesiologist, nurse anesthetist, down to the surgery assistants and the circulators, they all take pride in what they're doing in our particular rooms, because it is a little different than just regular surgery. So not just any circulator or assistant gets to help us in the robotic surgery. They have to have some training in it because it's unique. And it's a really tremendous tool that's allowed us to have a real positive impact on our patients. Similar story to Don's. The first place I went was just watching a gynecologic oncologist do a difficult procedure on a patient with cervical cancer using the robot. And I leaned over and I said, so, when is this patient going to go home? And he goes, probably about 3:30 this afternoon. And I was like, what? It just was a paradigm shift for me. I had really never thought of it in that light. And now we've done a lot to impact a lot of patients being able to go home with different procedures in a quicker time frame. But the device and the technology really plays a impactful role in helping patients recover quicker and stuff. And so I think for both of us, we've been able to see, I know for me, it has really allowed me to do some more difficult cases that I just in the past could not offer to my patients, a minimally invasive approach. And I really, like Don, took a lot of pride in my vaginal surgery work and in my laparoscopic surgery, but there were just some cases that I simply could not do. And the dexterity that you have with the robot, the ergonomics of how it works for me sitting at the console and operating, have made a huge impact on being able to really drive down the number of cases I have to do as an open procedure to, like I mentioned earlier, less than 1% in my hands. And so I'm really thrilled about that. And with the technique of learning hysterectomy and myomectomies and excision of endometriosis and difficult cases like that, we've been able to offer some treatment with pelvic organ prolapse that was not a technique that we offered vaginally or laparoscopically. We had vaginal surgeries we did for pelvic organ prolapse, and we'll talk about that on another podcast, but I was able to offer a robotic approach that has kind of become the gold standard for pelvic organ prolapse. And so this tool is really, really helpful. And so, we've got a ton of experience now over the last 11 years at the hospital in general and individually. Don, you've done, how many cases would you say you've done?
Oh, hundreds. To kind of put that in perspective, I was reading that kind of boggled my mind that the average OBGYN surgeon in this country performs 27 surgeries a year. That's according to statistics. Between you and me, we'll do that in 6 weeks. And so not that volume correlates to quality, but we're pretty good at what we do.
Actually, it does.
Yeah.
It does, and that's actually been proven in terms of high-volume surgeons tend to have better outcomes for patients than ones who are low-volume surgeons. And that's not a knock against the providers not doing as many cases. It's just with repetitiveness, and particularly with the device, the tools we're using, repetition breeds comfort level and expertise. And in fact, one of the big bugaboos with robotic surgery initially was the cost. I mean, you have a device that costs $1.5 to $2 million, and how does that come into play in terms of cost to either the health system or any particular cost to the patient per se? And what studies have shown is that when you take high volume laparoscopic surgeons, high volume vaginal surgeons, and high volume robotic surgeons, and you compare them in the cases that they do, the high volume robotic surgeons have better outcomes for their patients. Their costs
of
are
all
low.
groups.
Of all those three
That's
groups, their cost is lower, and their outcomes are the same or better. And so it really can help be a cost saver, as well as what's even more important from our perspective, while that is very important cost, the outcomes for the patient is ultimately the most important thing, the things that we're most focused on. And so, we have just taken real pride in trying to utilize this device where appropriate. There are certain patients in which a robotic procedure is not what they need. I mean, some patients need a vaginal procedure for certain indications, or they need something else. And even rarely, a patient needs an open procedure, and that's the appropriate procedure for that patient to have. But for many patients, and in fact, I would say most patients, a minimally invasive approach to their surgery should be the default position of the provider that they're seeing. And, I look at it as, when I hear of patients who have an open procedure done, and I know the circumstances particularly, and I just think, that's somebody's wife, that's somebody's mother, somebody's daughter who ended up with an open incision, a couple days in the hospital, 6 to 8 week recovery, who really could have had a minimally invasive approach, a robotic procedure where they went home the same day, they recovered in 2 weeks, 2.5, at most 3 weeks. Were feeling better sooner, their recovery was better, less risk of all the things we mentioned earlier. And it just disappoints me, I guess, is the way I look at it, because I realize that did not have to be.
Right.
And so I would say...
In our hands. And now, but still, the majority of hysterectomies in this country, like we started out saying, are still done abdominal.
Yeah, that number has fallen, actually, because of the advent of robotics, which was interesting.
But there are more, though, right?
No, I still think the number is transitioning to more minimally invasive.
Right.
And the reason
both laparoscopic and robotic.
That's correct. But robotics has begun to take over laparoscopy because of the ergonomics and you know how you and I were.
Absolutely.
When we would do laparoscopic surgery, we'd come home sore shoulders. You're looking at a 2-dimensional screen instead of a 3-dimensional screen. You're standing, and your movements are exactly the opposite of what you would normally do. And so with robotics, the movements are exactly in the flow of what you would normally do, and you are also able to get into markedly smaller spaces and suture inside the pelvis.
For the people that are listening out there that may eventually have robotic surgery, along those lines, the instruments that we use in robotic surgery are tiny.
Oh yeah,
we do a big work with a tiny instrument. I mean, compared to a pair of scissors that we would use in an abdominal case, the robotic scissors are
they're the size of a dime.
Yeah, compared to a pair of scissors you hold in your hand.
Exactly.
And that alone allows our patients to recover quicker, fewer complications,
right,
less blood loss.
Right.
And one thing that's important to us is, and we follow closely, and Jeff's been a big part of the robotic steering committee, is infection rate.
Right.
And we're able at Jackson-Madison County General Hospital with our robotic program to minimize infection rate as well as anybody.
Absolutely. I mean, patients obviously usually get antibiotics prior to the procedure, what we call prophylactic antibiotics. And that's helpful across the board on any procedure, particularly hysterectomy procedure. But the device and the minimally invasive approach is a huge factor in driving down infection rates. And so, patients do not need to be concerned about, I'm going to have a high risk of infection. It's actually the opposite. You have a markedly lower risk of infection through a minimally invasive approach, a robotic approach, than you would through an open procedure, no matter where you had it done. And we just are not seeing, again, our patients aren't in the hospital hours instead of days. And so, even during, some of the worst aspects of COVID, after we were initially had to defer any elective surgery in the month of April because of just the need to ramp up PPEs and masks and all that other stuff, we really have not seen any impact on our patients in a negative way, even during COVID, with infection rates. And so it's been a real blessing that patients have still been able to get the care that they need. And just as an aside, I would really encourage patients, don't delay your medical care that you really need just because of fear of COVID. I think, we'll take precautions. We've got to deal with what we're dealing with in this pandemic, but,
Our hospital has taken the lead with the number of patients they've been seeing and taking care of.
Absolutely.
And all those precautions there.
Right.
One thing that I want to talk about as far as robotics at Jackson-Madison County General Hospital is we're entering into our third generation robot.
That's correct.
When all this started, not that the original robots were bad, they were amazing, and they have served our community well, but we quickly, as a department, decided that we were going to be on the forefront of robotic surgery. And as a result, and I've got to give our healthcare system some real props for
they've invested in the device.
Investing in the program the way that really has benefited
Right.
our patients in West Tennessee
Right.
and beyond. We have patients coming from all over. I mean, from, we say river to river, state line to state line, but it's actually, we're going beyond state line, and we're actually opening clinics outside of Tennessee now, which is encouraging. But we started with the original robot, and then we bumped that up to the SI model, and then now we're actually converting all of our robots to the XI. It's kind of like iPhones, they just get updated, and we want to stay
and
with that.
And that's really, it's a partnership with the company that makes the robot, Intuitive Surgical, and they're a technology company, and so they're constantly innovating and trying to make things better. And so,
for people may not realize too, let me ask out there, what does a robot look like?
I tell people it looks like half of a spider.
It does. Now, what Dr. Ball is talking about is this robot. It just rolls right up to the operating table, and we're there while the robot is, we call it being docked.
Putting instruments inside.
It's kind of like Space Shuttle coming into the International Space Station.
Right.
And we're putting instruments into the laparoscopic ports that we've already placed. The robot doesn't do that. And then this robot that looks like, it's got multiple arms. They just kind of hover over the patient and hold these instruments. The newer model, the XI, is more above the patient.
Right.
But
there's a separate console where the surgeon sits, and so when I'm looking in this three-dimensional view,
now the console,
it's a separate place to sit. It's like a viewing station where you sit down and you put your eyes in a pair of what looks like binoculars.
We're about 12 feet from the table, 10 feet from the operating table.
And the other folks are still scrubbed in.
But we're talking, and I mean, it's a dialogue.
But basically, you have two toggles with your fingers in them and some foot pedals like you do on a piano. And so you move, when you move the toggles, the instruments inside the patient begin to move in exactly the location that you want them to go. And because they're so small, you're able to get in very tight spaces that you used to not be able to very effectively with your hands.
Right. And also I tell people, in a lot of ways, this 3D laparoscope that we use at the console, we're doing 3D vision. It's kind of like if you go outside tonight, this clear winter sky, and you look at the moon, and you can see it pretty good. But if you land on the moon, it looks a lot different. And it's amazing. The robot, we literally can just take our eyes down.
It's 10 time magnification.
And then you zoom down on top of that.
Yeah. And so
it's like we're landing on the ovary.
You get a view that you don't normally get. You certainly can't get from just with the regular eyes. And you also, the instruments can move
the dexterity of
540 degrees of rotation, which your hand can't even do. So it allows you to really, when Don talks about good surgical technique, it allows you to exercise good surgical technique in doing the procedure. And so, we're not doing a different procedure. We're just doing the procedure and it better. The robot allows you to do reproducible procedures again and again and again. And because you're doing that, you're getting the kind of outcomes that you want to get. And the instruments help you with proper placement of clamps and proper placement of your scissors. And again, because you're right there visualizing stuff so up close, you can see fibers of things. It's just amazing. So
we've talked about the robot, I think, and we briefly talked about our team. And Holly's not with us on this podcast, but we need to give her a shout out, Holly Maroney, who is a big help to us in the operating room. And
she's an experienced surgical nurse. And
one of the first people we had to bring with us when we started this venture at West Tennessee GYN Specialists. Jeff and I talked about it. We got to have a good first assistant, and that's her role. She is an RN-FA. She has gone with advanced certification to become a registered nurse first assistant to us. And we can tout all the numbers of robots that we've done, but when you really look at the numbers, Holly's done more than both of us because she operates with us, with each of us. And that's really important because the first assistant is the person that's at the table, at the side of the patient. that's
Exchanging instruments, moving, providing suction and some other things through a different port if needed.
giving us visualization with counter traction and all that. And so she actually, the robot makes us better surgeons, but she does too. And I think for our patients and people out there that are considering robotic surgery, that's important to know.
It is. And the thing is we're a tight-knit group that have done this repetitively. I mean, Don's done, at one time, over 500 cases. He's probably up to 750 or 800, I don't know by now. And I've done, 950, something like that. So, I mean, we have a lot of experience of doing robotic surgery over the years. And, the thing patients can feel comfortable is this is not our first rodeo. We've seen a lot of different things over time, had to handle a lot of difficult cases. And, we're always available to help each other if needed. But the good news is that, that's a rare need, because Don's got 30 years of experience and I've got 28, so in terms of having been in the pelvis a whole lot and seen a whole lot of things, it doesn't make us perfect by any means, and there certainly are other good surgeons in town, but we're very proud of the work that we do and the care we've been able to give patients, and we're grateful for the trust that they've entrusted in us over the years. And so we're more than happy to see folks and provide second opinions if they need it, or primary opinions, of course, on anything that they need. But we really feel passionate about robotic surgery because we've just seen the benefit for our patients. And sometimes there's more than one way to do a procedure. I don't disagree with that at all. But in our hands, for the most part, using the robot to help us accomplish the procedures that are appropriate to be done that way is what we used, and we're very thrilled and glad that we've done so.
One thing we didn't talk about, but we'll talk about it on another podcast, is when we're doing pelvic organ prolapse. Dr. Jeff Ball is at the forefront with the gold standard for a procedure that he does, and we'll talk about that later. We're blessed in this community to have him here to perform that for ladies. You want to talk just briefly about that procedure you do?
The procedure is called robotic sacrocolpopexy. It's a long term for women who have pelvic organ prolapse. It allows restitution of somewhat normal anatomy to where patients are comfortable and they can have a procedure that can, they don't have to have a pessary in the vagina anymore, or they don't have to deal with the prolapse that they've been experiencing with the drop in the bladder or the uterus or whatever. And it's just the procedure itself has been around since the mid-1960s. Formerly was through an open procedure. And a lot of gynecologists don't get much training in this procedure, or did not, because of the location of operating up around the sacrum area, where there are definitely some dangerous blood vessels that you have to be mindful of. And so most gynecologists use a vaginal approach to pelvic organ prolapse, and in some cases that's totally appropriate. There's just a trade-off when you use a vaginal approach versus an abdominal approach through a small incisions, and that is the long-term success rates are better through the abdominal approach, the sacrocolpopexy approach, rather than a vaginal approach. So there are some slight risks that are different as well, and it's it's a detailed, complicated procedure, but it's one that I've just seen excellent results in patients. So I'm grateful that after we became experienced in just routine hysterectomies and other things through using the robotic device, it allowed me to be able to then begin to push forward into this procedure and be able to offer that to patients so they don't have to go to Memphis or Nashville for it. So,
but are you not the only surgeon between Memphis and Nashville that is performing this particular gold standard?
To my knowledge, yes, but I don't know that with 100% certainty. But
I think so. And the numbers you've done are right up there too. So but we'll talk about that later. Sure. And I just got to fly his flag on that a minute.
You're kind. Thank you, Don.
Well, I think we can easily say that we've got two experts right here, and we are proud to have them as a part of West Tennessee Medical Group, and that's why we say that we are the care you trust right here at home. We have this expert care. So if you are looking for a women's health provider in this area, then please call the clinic, West Tennessee Medical Group GYN Specialist, and the number is 731-660-3344. We've been talking with Dr. Don Wilson and Dr. Jeff Ball, and again, we are thankful to have this level of expertise right here within West Tennessee Healthcare. So thank you for joining this episode of We Talk Health.